All right, we are gonna now evaluate the different cranial nerves. One of the first things that you want to do is look at the symmetry of the face. You want to make sure that there's no atrophy of any of the muscles on the face. You want to make sure that both nostrils are equally open, that there is no deviation or drooping in the horse's nose, that there is no droopiness in the lip. Those might be signs of facial nerve paralysis, that there is no swellings visible anywhere on the face. And you also look at eye positioning. You look for the presence or absence of nystagmus, so that would be a sideways movement of her eyes. And you also want to evaluate the angle of the horse's eyelashes compared to the eye. So that will make it easier for you to see if, for example, the horse has a droopy eyelid, which again might be a sign of facial nerve paralysis. You could also have a horse in which one ear is lower on one side compared to the other. And you can evaluate all these things from a distance, just with the horse doing its normal behavior. And then you can start in a very gentle way to evaluate the horse's sensation. You can do it with your finger, or you can do it with a pen. You want to always also evaluate a little bit of the inside of the nose. And you just want to get an idea whether the sensation is normal on both sides of the face. You need to do this very gently because some horses might not like it at all. You also do what's called a Menace Reflex, which means that you want to do a movement towards the horse's eye. There are two things that are important for that. You don't want to actually touch the eye or the eyelashes, because if you do that, you're going to evaluate sensation, but not really your eye reflexes. And you also don't want to induce a brusque movement of air. So you just want to have your hand ready and kind of do a quick motion like that, and make sure that on both sides the horse is able to blink. Now I might potentially be able to do the same thing, just touching, eyelashes, which that evaluates a different type of cranial nerve.